A 32-year-old woman, low platelet count, asymptomatic, repeat CBC showed thrombocytopenia. Which of the following is the most appropriate next step? So we have a patient with isolated thrombocytopenia but no symptoms. Not even continuous symptoms like we talked before. She has nothing wrong, but her platelet count is so low. So what should we do now? As a question, you should never answer this wrong. If you think of it as ITP, we already mentioned that you treat it if there is bleeding or platelet count is fewer than 30,000, and none of them exists here. So A is wrong and B is wrong. Also, we don't do biopsy in such cases even if it was ITP. But we already said in a previous video that if the case is newly diagnosed ITP, you should screen for HIV and HCV. So is E the answer here? No. The correct answer is D, because this is a case of pseudo-thrombocytopenia, which is a lab error, meaning it's not true thrombocytopenia, and this is not ITP, of course, just a lab error. And it might occur because standard CBC tubes contain EDTA, which is an anticoagulant that causes in vitro platelet aggregation, so falsely low platelet count. And this is how it looks on a peripheral blood smear, this aggregation. So this is not ITP, not true thrombocytopenia, because true thrombocytopenia cases always have symptoms, at least cutaneous like easy bruising and petechia. So before doubting, repeat the test using a saturated tube to make sure it's not true thrombocytopenia. And if the repeated test confirms, then do nothing, just reassure the patient. And here are our side notes which I recommend you to read.